Does your baby sleep like this? Yep, this is a baby with the mouth open. Now, you might be saying, well, don't all babies end up sleeping with their mouth open? Not necessarily, and no, this is not normal and it's not good for the baby overall. So I'm going to tell you exactly 6 different reasons how this can impact your baby in the long run. And we're going to talk about what to do about it. Now, before we dig in, I just wanted to introduce myself. I'm Adriana. I'm a pediatric occupational therapist of 13 years and also NICU therapist. I have a son who also has feeding issues and developmental delays, and I totally understand the first year of life is very stressful with so much information that's out there. But I am here basically to help empower you as a parent. I not only empower you as a parent, but I also attempt to help you learn to create an optimal foundation for your little one for the future. Now let's talk about the 6 different things how mouth breathing can impact your little one as they get older. Number 1 is concentration, poor concentration. Poor concentration unfortunately leads to poor academic performance, and it actually misleads a lot of medical professionals to diagnose your little one into ADHD or ADD. Number 2, it affects the facial structure. So what am I talking about? Little ones who end up mouth breathing for a long period of time and continue to mouth breathe, what ends up happening is they end up having their face they end up growing up and their face starts being a lot more elongated. Their jaws are a lot more smaller. The nostrils of the noses are a lot more smaller because they're not breathing through the nose. And the other thing that's also impacted is they have a high arch palate. And when you have a high arch palate, the issue is that the teeth don't have enough space to be able to grow, and they end up having crowding of the teeth. And this happens because the tongue isn't up at the roof of the mouth to be able to. One other thing too that a lot of the doctors and physicians end up noticing with mouth breathing kiddos is they have dark circles around their eyes because they're a lot more exhausted and very tired. Number 3 is swallowing and speech. It can affect this because if you're having different structural features of the face, it impacts your swallowing, and it also can impact your speech. And you end up compensating with your tongue in different positions when it comes to speech and swallowing. Number 4, it affects the baby and the child as a whole in terms of their growth. So what am I saying is because there's lack of efficiency, again, of oxygen, does not help the kiddo grow in length. Number 5, this one's a little controversial, but I'm just gonna say it overall. Because it affects the overall facial features, it can affect the posture of your body as well too. So more forward, more hunched back, instead of having a more upright body posture. And number 6, last but not least, you get more cavities when you mouth breathe because you're bringing in all the bacteria in your mouth and you're not maintaining the mouth closed. All right, so let's talk about these different things that can cause mouth breathing that I investigated. Depends on how tight the frenulum is, meaning that what's underneath the tongue, depending on how tight it is, it's gonna bring down that tongue and it's gonna make that tongue work a little too much. So when it comes to breathing nasally, they're gonna tend to open up that mouth because the jaw is pretty heavy, it gets kind of loose when you end up sleeping, and it ends up unattaching from the top of the roof of the mouth. So ideally, when a baby is sleeping, it's really important to maintain that tongue up to the roof and suctioned up. For older kiddos, one of the main things that I ended up noticing or investigating is that they have either enlarged tonsils or they have allergies and or even a deviated septum. Now let's talk about what to do for these little ones that are mouth breathers. There's 2 different things that you can do. Number 1 is oral play. Oral play is mainly really getting your fingers in there, playing with them, bringing those fingers right underneath the tongue, lifting up that tongue, and just stretching up that frenulum or anything that's underneath the tongue, just to make sure that you're stimulating that tongue, and also around the cheeks and around the gums. Number 2 is pushing up against the jaw. And you could see on this video that she's mouth breathing, so I'm lifting up that jaw. Right behind that jaw is the tongue, and I'm lifting up her tongue with my finger, and I'm making sure that the tongue is suctioned up at the roof of the mouth. And one way of checking is I drop down the jaw and I make sure that the tongue is up at the roof of the mouth. And if she brings that tongue right back down when I push it down the jaw, again, I do the same thing. I bring back up the jaw and I go right behind the jaw and I lift up the tongue, and that does help with making sure that the tongue is suctioned up at the roof of the mouth, again, to be able to expand that upper palate. I hope this video was really helpful for you guys in terms of mouth breathing, since it's really a hot topic for the adult population. But I feel like as a therapist, it's very important to start now with your baby and make sure that you're following through with and keeping an eye out on your baby, and especially in the way that they're breathing and the quality of sleeping. Subscribe to my channel and hit the notification bell just so you can continue to get updates on all these different types of videos that I'll be doing.